Welcome back to Catalyst University. My name is Kevin Tokoph, and in this video, we're going to be looking into what the evidence says is best for strengthening the adductor, that is ADDuctor muscle group. And if you do an internet search of this through the literature, you'll find that it's pretty sparse of information. There's not a lot of studies that are looking into this. This is a really big gap in our knowledge. But we're going to use what is available to come to some conclusions, hopefully, about how to best get strength gains in the adductors, the inner thighs. So here's the first paper that I found, Adductor Longus Activation During Common Hip Exercises. Now, one obvious weakness of this paper right from the get-go is that it's only looking at adductor longus. However, we can probably conclude that whatever adductor longus is doing is similar to what's happening in most of the other adductor muscles. Okay, so it's probably a pretty close approximation. And to really summarize this, they found that out of all the exercises they looked at, and those included side lunges, standing adduction on a Swiss ball, rotational squats, sumo squats, the best exercises to actually activate the adductors are sideline hip abduction and ball squeezes. Those give the highest activation. And we'll be looking into what these exercises look like at the end of the video once we get through all this verbiage here. But you actually see these are the two exercises that are best for activating these muscles. Now, a word here on ball squeezes. When I'm in the clinic, if I have a patient that comes in that's pretty low level, they've got global weakness throughout the lower extremities, that would include the adductors, I would start them on ball squeezes. That's because they have very low strength from the get-go. And yes, doing that exercise will probably improve the strength a little bit in those muscles. But if I have somebody who's an athlete, or at the very least a higher level individual, I'm not going to give them ball squeezes. It's good for activating the muscle, but you're not likely to get a lot of strength gains past the initial basic ones if you're really weak, because with a ball squeeze, you're not really lifting through a lot of resistance. It's not a big load. Okay, so I'm not going to be going into this exercise here in this video. It's a pretty self-explanatory exercise. You just take your thighs, put a ball with some compressibility there, and just squeeze it. Okay, for low-level patients, it's great. For high-level, not so much. But the sideline hip abduction, we will be going over a little bit later, so keep that one in the back of your mind. Second study here. EMG evaluation of hip adduction exercises for soccer players, implications for exercise selection in prevention and treatment of groin injuries. Long story short, they looked at quite a few adduction exercises, but they came to the conclusion that the Copenhagen Exercise exercise, or just Copenhagen's, and hip adduction with an elastic band, that these are good exercises for the adductors and they should be included in programs to help prevent groin injuries. So these are actually really good exercises. If you've tried these, you can actually get a lot of gains in the adductors with these two. So we'll be taking a look at these a little bit later as well. And then the other one that I found that was relevant was the neuromuscular effects of the Copenhagen Adductor exercise. This is a systematic review. And what they found is that the Copenhagen exercise improves a lot of things here. Okay, it improves EHAD, which is the eccentric hip adductor strength, which is important in the control of the hip in certain movements to prevent injury to the groin. It improves the EHAB. So it actually improves the eccentric hip abductor strength. Not that we're really concerned about that here, but it actually does get some gains in the abductors as well. But it also improves the EHAD to EHAB ratio. That is the eccentric hip adduction strength to abduction strength ratio. So the ratio of the inner thigh muscles to glute med, gluten, etc. It improves that ratio. And then in general, it gets a lot of activity of the adductors via electromyography. So based on this review and the previous study, you can see that Copenhagen's are where it's at. They're really good for the adductors, and while they're not the only exercise by any means, if you do these exercises, the Copenhagen's that is, you will feel your adductors. They are great for strengthening. You'll probably have some muscle soreness in them the next day if you're not used to them, so they're really good. But long story short, there is not a lot of papers on this that are really good and are looking at various exercises and how much they activate the adductors. We really don't have a lot of information. So we're going to use some of these. I'm also going to use some of my own personal fitness and clinical experience when we're looking at some of these exercises. And before we get to those, I think it's really important to do an anatomy review of the adductors, because depending on the exercise choice, we may or may not be getting all of the adductors. And so there's some considerations that we need to take. And those are really whether it's a one joint muscle or a two joint muscle. So pretty much all the adductors are one joint muscles. Those are the pectineus right here. You can see the adductor longus right here, the adductor brevis, the adductor magnus, and not shown here is what's called adductor minimus. So right up here where my mouse is, that is adductor minimus. Now, some sources will describe it as a separate muscle, but realistically, it's just the superior or proximal portion of the adductor magnus. So this up here, you could just call the horizontal fibers of the adductor magnus, but it could also be called adductor minimus, all right? And then there's a two joint muscle, and that's this one right here. This is the gracilis, okay? If you've ever tried to do the splits or done it by accident and gotten pretty close, and you get to the point where you feel limited, a lot of people will feel a sharp pain in right around their groin. That really sharp pain, that sharp stretch, in all likelihood is the gracilis. Now we know that when a muscle's tight, there's a reason it's tight. Sometimes it's because that muscle is weak. And we have to look at these exercises, because if we're only doing exercises that benefit the one joint muscles, but we're neglecting the gracilis itself is probably a little bit weaker, and that may contribute to it being tighter, and that can limit flexibility of the adductor group. Okay, so we need to make sure that we're really hitting all of these muscles. Now, how do we do that? Well, the one joint muscles are best strengthened with the knee bent or flexed. Okay, so they don't cross the knee joint, they only cross the hip joint. They facilitate only hip adduction. They don't cross the knee joint, so this is not because of an active insufficiency consideration. It's just when you have the knee bent, you shorten the moment arm. And so there's less gravitational torque on the thigh, and it's easier to move the thigh. So if you're going to strengthen the one joint muscles, you best do it with the knee bent. It's just going to be easier, okay? But we should also consider the two joint muscle, the gracilis. And this is best strengthened with the knee straight. When the knee is bent, the gracilis is on active insufficiency, and it's not going to function as well. It's not going to activate as much. You're not going to get as much strength gains in it. So it's important to also work adduction with the knee straight. Yes, the other ones will work, but it will also get the gracilis a lot more. And so the bottom line is our exercise or treatment approach is going to be one that involves a mixture of adductor strengthening with the knee bent for the one joint muscles and the knee straight to really get that gracilis. And as you strengthen the gracilis, you might actually find that your flexibility in terms of spreading the thighs apart into abduction, abduction that is, may actually improve. We're going to begin by taking a look at the exercises for the one joint muscles, that is with the knee bent. Now, this first exercise is not included in these studies, but I actually find it very, very useful for strengthening the adductors, and this is the adductor machine in the gym. Now, the nice thing about this exercise is that the movement is on a fixed path because it's a machine, so it can really allow you to load up some really heavy weight, and this can get you some really good strength gains in the adductors. The weaknesses of it is that, number one, it's with the knee bent, so you're not really getting much of the gracilis. Number two, it's on a fixed path, so it takes away that instability component that you might actually want to work on, particularly if you are trying to rehab a groin injury or prevent one in the first place. Really making sure that you're strengthening in maybe compromised positions or where you don't have a fixed path, okay? But this, again, can be used to get some really good strength gains in the adductors because you can load so much weight. And some people don't like this exercise. It's not functional. Well, one area where it is functional is actually in jiu-jitsu. So if you happen to get somebody in a clean guard, a pretty tight guard where your feet are crossed around their back, you can actually make it really difficult for somebody to escape that guard. If your adductors are incredibly strong and have really good endurance, you can really wear somebody out and keep them in that pretty good and give yourself enough time to do some kind of technique like Kimura or guillotine or something like that, or make a transition to another position. So That's an area where having strength in this muscle is very important. So yes, you can just rep it out on the adductor machine, but one really good way to train this is to get a weight that's as heavy as you can and hold it for as long as you can. At least 30 seconds going upwards of a minute. You can really get some good strength and endurance in those adductors this way.
Now, as I mentioned before, the adductor machine in the gym is excellent for building strength, endurance, etc. in the adductors. We talked about that just a minute ago. If you don't have access to a gym or don't have access to a gym that has that machine, this is another way that you can get activation of the same muscles in a very similar movement pattern. So for this one, you're gonna lie on your back, and I've got a thick resistance band, monster band, pull-up band, whatever you wanna call these. It's wrapped around my squat rack. It's gotta be wrapped around something that's very sturdy, heavy, that's not gonna move anywhere. And then I have the band itself around my distal thigh. So it's not on the knee joint, it's not on the lower leg, it's right on the end of my thigh. What I'm gonna do here is plant my heel on the ground and let this rotate out with control. That's using the eccentric activity of the adductors, and then I'm gonna pull this in. When I do this, I try to pull it a little bit past midline. So this is my midline right here. I'm pulling it a little bit past that. So here's 0 degrees. I'm gonna let this come back out with control, pull it back in a little bit past 0. Remember that the peak adductor activity is around 0 degrees. You'll still get some as you're coming up here, but it maximizes around 0. And if you push it a little bit past, you get a little bit more activity beyond that. Arguably one of the best type of exercises for the adductors is the Copenhagen exercise. There is a full Copenhagen and then there's a modified Copenhagen, which is the regression. Even though it is a regression, it is still a fantastic exercise, and pretty much everybody who is higher level should be doing this to strengthen these muscles. If you don't know if you can do a full Copenhagen, you should first see if you can do the modified one first, because if you can't do that, there's very low likelihood you're gonna be able to do the full one. So we're gonna start with this one. It's modified because the knee is bent. That's gonna dramatically shorten the lever arm here and make the movement easier. So I'm gonna be strengthening mainly my left side here, but depending on how you do this one, you can also get the right side as well. I'm gonna be on my right side and propped up on my right forearm. Now, the modified Copenhagen is like this. You're basically going to do a side plank, pressing this into the bench here, like this. I'm also bringing my right leg up to meet the left, or get pretty darn close to it. Now, if you try this at home and you're not able to do this, you can regress this further. The way you do that is you keep the right one on the ground and just work the left side. Okay? Most people who are at the very least moderate level should be able to do that. If you keep doing this, your adductors on that side, left, will get stronger. If you're still having trouble doing this, what you can do is you can add a little weight here. I would put the weight kind of on your hip right here, and you can gradually increase the weight doing this form of it until you develop enough strength to do the modified Copenhagen like this. So going from the modified Copenhagen to the full Copenhagen is a good transitioning point between exercises that really only work the one joint adductors to now starting to get a little bit more of the gracilis, which is probably weak in a lot of people, especially if when you try to get more abduction or do a splits type of movement, you feel a sharp pain near the groin. That sharp pain is in all likelihood a really tight proximal gracilis. And as we know, a lot of times when there's a tight muscle, it's not that necessarily you need to stretch it. It can help, but you probably also need to strengthen it. And so getting into working the two joint muscles, really just the gracilis with the knee straight, is going to be a good way to do that. Now, out of all these straight knee adductor exercises, this is the most difficult. We're going to look at a little bit of an easier one in just a minute, but we're going to start with the full Copenhagen. So the full Copenhagen, now you have the working side knee straight as opposed to bent when we did the modified Copenhagen. You're still going to be propped on your forearm here,
But now the bottom leg is also going to be straight. So a full Copenhagen looks like this. So this is obviously a very difficult exercise. And if you're still having trouble even doing one repetition there, you can do one of two things. You can either go back to the modified Copenhagens and put an even bigger weight on your hip and really just load that up. Or you can take the full Copenhagen and regress it. So you'll notice when I did that full Copenhagen, I was lifting the right leg up as well. I can, again, keep this right leg on the ground here, and that's a good regression of this exercise. That'll look like this. And you should do this, and potentially even add a little weight here like we did before. Put this on the hip, and progressively overload that weight until you can go to the full Copenhagen like this. So for sideline hip adduction, I'm going to lay on the side that I'm going to try and strengthen. I'm going to lay on my right side, so I'm going to be strengthening the right adductors. What I'm going to do with the top leg is actually cross it over the leg that I'm trying to strengthen. I'm going to make sure I keep my right leg straight, and then I'm going to lift this up, hold for as long as I want to, come back down. Now remember, adduction doesn't have a tremendous range of motion, particularly active range of motion. So you're not going to bring it super far off the table, and that's okay. So this is sideline hip adduction. Now, if I want to add resistance to that, I could certainly put an ankle weight around my ankle. The other way I can do this is by adding a little resistance band. So with this one, I've got this resistance band on the floor, anchored around a weight. So same idea, I'm going to lie on my right side, cross the left leg over, and then again, lift that up. We're now going to take a look at standing banded hip adduction. So in this case, I'm going to be strengthening my right side here. I've got a thick band, monster band, pull-up band, whatever you want to call it. It's attached to a really sturdy structure that is my squat rack there. And then I've got it also wrapped around my foot. Now you'll notice that the band itself is not going horizontally along the floor. It's actually going from my foot upwards at an angle. Probably about 20 or 30 degrees is going to be enough for this. That's going to maximize activity of the adductors here. I'm also going to be using a PVC pipe here, some kind of a stick, something for balance. We're trying to strengthen here, so let's take balance as much as we can out of the equation. Once we're more comfortable doing the movement, we can put the balance consideration back in. So it's going to look something like this. Left leg's going to be planted. I'm going to let this come out with control and then drive it back in towards the other side. Okay? Couple considerations here. One thing you'll often see is as a person's letting this come back out, and even as they bring it back in, they're letting that hip externally rotate. You can see that because my foot is rotated outward. We don't want to do that. Number one, because when we do that, we take the adductors out of the equation a little bit and we put it more into a hip extension type of movement. So the hamstrings and the glutes begin to take over. We want it to be the adductors. The other reason is because remember the adductor group also functions as internal rotators of the hip. So not only do we not want to let this externally rotate, we actually want to keep that foot pointed forward and potentially rotate it inward just a little bit, especially as we come back. The other thing I'm doing is I am not bringing this to the ground. Then there's no point in the exercise. I want to keep my foot just barely touching the fibers of the carpet, but not actually in contact, not weight bearing. That's going to keep the tension in the adductors as I do this exercise. And like with any of the others that are straight leg, remember that the adductor group functions maximally when the hip is at 0 degrees. It's active out here, but as we approach 0, that is neutral, it becomes more and more active. Okay, so you don't want to just do this. We want to take it all the way in, hold it here where we're getting the most activity, and then come out with control while we're eliminating that external rotation, keeping the foot and hip more in neutral or even slight internal rotation. So up until this point, every single exercise that we've looked at for the adductor group, more or less, is an isolation exercise. And those are definitely good, but our discussion would not be complete without talking about other exercises like the deadlift and squat, which can also heavily hit parts of the adductor group, in particular the adductor magnus. Remember that the adductor magnus is the only one that functions as a hip extensor. In fact, some textbooks will talk about that muscle being part of the hamstring group because it's so powerful as a contributor to hip extension. Now, I would make an argument that a conventional deadlift is mostly getting glutes, hamstrings, and lumbar paraspinals. But considering that the adductor magnus is also a hip extensor, it's going to hit that muscle pretty hard as well. We could also do sumo deadlifts where we take a wide stance, because whenever we descend down, we are going into more of hip abduction, abduction that is, and on the way up, we are having to drive those legs together, which is hip adduction. And so you are also going to get some adduction activity with the sumo variation. But with a conventional stance, this one is going to be much better for getting that adductor magnus, which sometimes is not hit quite as hard when you're doing the other exercises. So conventional really gets that adductor magnus, and also in a squat. So a lot of times when you're squatting, especially if you're using a little bit of a wider stance, as you descend down, you can see that the hips are going into abduction. So it's the adductors that are controlling that in the frontal plane. And then on the way back up, the thighs are coming back together. That is the concentric action of the adductor group, but especially that adductor magnus, because not only are the thighs coming back together, but we're also engaging hip extension at the same time. So that's going to really get that adductor magnus good. So we just got through loading up the adductors in strengthening exercises, and this would not be complete without talking about a little warm up and a cool down. So what I'm going to show you is a dynamic adductor stretch. It's a half kneeling adductor stretch. You can use it as a dynamic warm up, as a cool down. Take the holds up a little bit longer for each of the shifts outward. You'll see what I mean in just a minute. So the overall movement looks like this. You're going to be kneeling on one knee and then have your foot out like this towards one side. This is the side that we're going to be stretching. So this is going to be a left adductor stretch. I can certainly have my hands on something for a little bit of balance because I want to focus all of this on the stretch. This is not a balance exercise. I'm going to keep my chest facing forward. I'm going to put one hand on my leg here to prevent this from coming forward, maybe one hand for balance if I need it, and then just shift out laterally, okay? You should feel your inner thighs stretching here. Most of you will probably feel it more proximally closer to the groin. So as a warm-up, I might hold these a little bit less time, maybe 1 to 2 seconds, gradually going out further. As a cool down, once I've done all this strengthening, I might come out here, really hold that, and then come back. But make sure that not only are you strengthening the muscle, but also make sure you maintain its flexibility. If you do this both before and after, particularly the dynamic stretching, not static stretching, dynamic stretching can reduce risk of injury because it gets blood flow to the muscle. And then cooling down with a little dynamic stretch afterward can help prevent as much delayed onset muscle soreness. Can it clear some lactic acid out of the muscle? So make sure you are stretching as well. So hopefully this video gave you some good information about what the evidence says for how we can best get strength gains in the adductors. Please make sure to like this video, subscribe to my channel, and hit that notification button for notifications for all videos in the future. Thank you so much.